Great news for the more than 500,000 Americans with multiple sclerosis. Lori Johnson tells us the FDA just approved a new drug that is so much better than the others. One doctor described it as the difference between a cell phone and a landline.
Rebecca Cherubini has been struggling with multiple sclerosis for 15 years.
I surrendered it to God. I'm like, if this is your will, I would love for you to change it, but if not, okay, then you need to give me the grace to deal.
Like most, her MS came out of the blue when she was young.
Blurred vision to the point where I started to become nervous about driving. And then one day I was actually going to work and I pulled off.
Other symptoms include fatigue, falling, and difficulty thinking. MS is an autoimmune disease. That's when the body's immune system mistakenly attacks healthy tissue. In the case of MS, the immune system attacks nerves in the brain and spinal cord. It gets worse over time, and there's no cure.
I want to be able to drive my kids to soccer. I don't want to be debilitated. I don't want to be in a wheelchair.
Now, Rebecca may get her wish. She's one of dozens of MS patients to test a new drug called ocrelizumab. It works to stop the cells in the immune system from attacking the central nervous system. And it's clearly effective. It's been shown to stop the disease in its tracks. Not just the more common relapsing form of MS, but also the most aggressive type, which is called primary progressive.
Ocrelizumab was the first medication tried in primary progressive MS that actually worked.
Dr. Michael Reiki oversaw the ocrelizumab trial at the Ohio State Medical Center and says patients call it a game changer.
They say, I really haven't had any kinds of effects from my MS. And that's really obviously quite satisfying as an MS physician who, can remember the days when we really didn't have anything to treat patients.
I feel normal again. I was telling them, I just feel normal.
Ocrelizumab is just one 4-hour infusion every 6 months.
This medicine, I don't have to worry about it. Do you know what I mean? I don't have to take it every day. I don't have to worry about ordering it. I don't have to worry about any reactions to it.
It costs $65,000 a year, which, believe it or not, is less than most MS drugs. And while this breakthrough can stop the progression of MS, doctors still don't know what causes the disease, so prevention remains a mystery.
If you look at identical twins, when one twin gets MS, 70% of the time, the other identical twin, who clearly has the same genetics as their brother or sister, doesn't get MS.
Since MS is an inflammatory disease, things that cause inflammation, like obesity, stress, and smoking, could factor in. Early studies show vitamin D might help prevent it. Lori Johnson, CBN News.